Celiac disease, also known as gluten enteropathy or celiac flu. Celiac disease, a chronic immune disorder triggered by gluten ingestion, and it results in the damage of intestinal lining and causes the diarrhea, fatigue, weight loss, and bloating and anemia. It is autoimmune disease. Here we go to talk to pathophysiology, risk factor, sign symptom, laboratory result, diagnostics, treatment, and family education. As I told you, celiac disease is an autoimmune disorder that causes the gluten intolerance. So in this picture, this is the food contain the gluten, and gluten intolerance in celiac disease. The 5 common gluten food like grains, processed meat, sweet and sweet alcoholic beverage, and also seasoning and some condiment. So next go. Intolerance of gluten, the protein component of wheat or barley, rye, and oat is characteristics. So indigestion of gluten results in the damage to the small intestine and leading to malabsorption. Celiac disease results in accumulations of amino acid glutamine, which is toxic to intestinal mucosal cell. And intestinal villus atrophy occur, which affect absorption of indigested nutrient. Symptoms of disorder occur most often between the age of 1 and 5 years. There is usually an interval of 3 to 6 months between the introductions of gluten in the diet and the onset of symptoms. Strict dietary avoidance of gluten minimizes the risk of developing malignant lymphoma of the small intestine or other gastrointestinal malignancies. So what are the risk factors? Risk factor is immune dysfunction. Is it autoimmune disease? So here, data collection, acute or insidious diarrhea, stool are watery and pale with an offensive odor. Steatorrhea means stool mixed with fat. Lethargy or anorexia, abdominal pain and distension. Muscle wasting, particularly in the buttock and extremity, vomiting, anemia, and irritabilities. So abdominal pain and distension is most characteristics. All of this lead to the failure to thrive because of malabsorptions. So normal villus in this picture, here in gluten disease, we can see the villus damaged. So there are no villi. Lack of villi actually leading to malabsorption. Because of malabsorption, lead to failure to thrive. So before to go celiac crisis, it is important to discuss with us what are the lab work. Serological test is important, or duodenal mucosal biopsy can help. So the treatment is strict to the gluten-free diet. So intervention, gluten-free diet and substitution of corn, rice, or millet as gain sources. Lifelong elimination of gluten resources such as wheat, rye, oat, and barley. Minerals and vitamin supplement include iron, folic acid, and fat-soluble supplement. Fat-soluble vitamin A, vitamin D, vitamin E, and vitamin K. So reinforce the teaching the parents about the gluten-free diet and to read food label carefully for hiding the source of gluten. So reinforce the instruction to the parents regarding measures to prevent the celiac crisis. Inform the patient about the celiac screw association. So it is good to provide information. So what are the substitute gluten with corn, rice, and millet? So here in the picture, we can see 5 common gluten food. Now, basic of gluten-free diet. Food allowed, food prohibited. Meat such as beef, pork, poultry, fish, eggs, milk, and some dairy product, vegetables, fruits, rice, corn, gluten-free flour or rice. Also, pre-cooked gluten-free cereal are allowed. What are the food list prohibited? So prepared rice, ice cream, melted milk, prepared pudding, gain, including anything made from wheat, rye, oat, barley, such as bread, rolls, cookies, cake, cereal, right? Macaroni, noodles, beer, else.